Hi, I'm Dr. Bill Carlazon, Principal Editor of NPP Digital Psychiatry and Neuroscience. Welcome to the DPN Deep Dive, our journal's AI-generated podcast that summarizes DPN articles in short, accessible episodes. Each episode is created using Google's Notebook LM, refined by our tech-savvy social media team, and approved by the authors to ensure clarity, accuracy, and approachability. Let's dive into this episode to explore the latest research in digital psychiatry and neuroscience.
Today, we're tackling something huge. Social media and its impact on youth mental health. It's
Yeah.
everywhere, right? Even the U.S. Surgeon General put out an advisory recently, so it's definitely urgent.
It really is. And for this deep dive, we're zoning in on one specific, very important study. It's titled, Probing the Digital Exposome. Associations of social media use patterns with youth mental health.
Okay.
This research comes from top teams, Children's Hospital of Philadelphia, the University of Pennsylvania, and Columbia University.
Wow, heavy hitters.
Absolutely. And they didn't just talk to a few kids. This involved a huge nationally diverse sample, over 10,000 adolescents across the U.S.
10,000. Okay, let's unpack this because that scale is impressive. You mentioned digital exposome. What exactly is that? Sounds comprehensive.
It is. Think of it like this. Instead of just looking at, say, how many hours someone spends scrolling, the digital exposome captures the whole picture. It's the cumulative burden, you could say, of all their different digital experiences combined.
Ah, okay, so like everything together.
Exactly. This study used a data-driven method to bundle all these different exposures into a single digital exposomic risk score.
A risk score. Got it. Higher score means more digital stress.
Pretty much, yeah. A higher score indicates a greater overall digital risk profile associated with poorer mental health.
So what specific things pushed that score up? What were the biggest red flags they found?
Well, three things really stood out, with the strongest links to worse mental health outcomes. First, having social media accounts that kids kept secret from their parents. That's a big one.
Secret accounts. Okay, I could see how that might connect. What else?
Second, showing signs of addictive patterns of social media use, compulsive checking, letting it interfere with life.
Right, that addictive quality makes
Mhm.
sense. And the
Mm.
third,
Cyberbullying. Experiencing it was, perhaps unsurprisingly, very strongly associated with negative outcomes.
okay, those three secret accounts, addictive use, cyberbullying definitely sound concerning, but was there anything unexpected?
Actually, yes. Here's where it gets really interesting. They found a protective association for young people who had a private social media account.
Protective, you mean like it was better for their mental health compared to having a public one?
Exactly. Friends-only settings seem to be linked with better outcomes compared to complete public profiles.
That's fascinating. So it's not just if you use it, but very much how and with whom.
Precisely. And these risk scores, this whole digital exposome concept, wasn't just trivially linked to feeling a bit down. They were significantly associated with higher levels of general youth mental health problems, and even, sadly, a history of suicide attempts.
Wow, that's serious. And this wasn't just because these kids were spending more time online in general, watching videos or gaming.
That's a crucial point. No,
No.
the researchers were really careful about that. They found this link remained strong even after they accounted for general non-social screen time, like videos, gaming, and also other really tough non-digital things kids might face, like poverty or abuse.
So it really isolates the social media experience, the nature of those interactions.
Yes, it strongly suggests it's about what's happening during that social media time, not just the minutes ticking by.
So what does this all mean when we look at different groups? Did everyone experience this digital risk the same way?
No, there were definite disparities. The study found that these digital explosive risk scores were highest among non-Hispanic Black youth.
Higher than other groups.
Yes, followed by Hispanic youth when compared to non-Hispanic white youth. Also, youth identifying as sexual and gender minority SGM, they also showed significantly higher risk scores.
So certain groups seem to be facing a heavier load of these digital risks.
It appears so. But there was a really interesting kind of complex finding with Black youth, even though they had, on average, higher digital exosomic risk scores. The association between that risk score and their mental health outcomes was surprisingly weaker than in other groups.
Weaker, so higher risk, but less associated impact. How does that work?
Well, it raises questions, doesn't it? It might suggest potential protective factors at play, maybe specific kinds of online community support or resilience factors within those communities. It needs more research for sure.
That is a really important nuance. It shows things aren't always straightforward.
Definitely not.
Yeah.
It highlights that we can't just paint everyone with the same brush when we talk about online risks.
So wrapping this up, this deep dive really underscores that we need to get past just blaming screen time. It's about the specific ways kids are engaging online, the patterns, the cumulative load of different experiences. That seems to be key for understanding the mental health connection.
Absolutely. It's about the quality and context, not just the quantity. And, as a final thought, while we focused a lot on the risks here, which are real and serious, we should also remember social media isn't all bad. For many young people, especially maybe marginalized youth, it can be a vital space for connection, finding community, exploring identity.
That's a crucial balance to keep in mind.
It is. So maybe something for you, the listener, to mull over is, how can we better understand and even support those positive uses, especially for kids who need that connection most? What might future research tell us about that side of the coin?
A great question to end on. Lots to think about there. Thank you for joining us for this deep dive. We'll catch you next time.